The conversation surrounding what affirming care looks like and how we get there is continuously developing, and groups in our own backyard have band together to chase this vision. Today, WGVU's Jennifer Moss is in the studio with Jenny Knight from the Grand Rapids LGBTQ+Healthcare Consortium to tell us more about this effort.
So we want to thank Jenny Knight for joining us today. You are, of course, the Executive Director of the Grand Rapids LGBTQ+Healthcare Consortium. So we welcome you today.
Thank you. It's been lovely to be here.
So today, of course, we are talking about the Healthcare Consortium and the need for such an organization. Tell us about your mission.
Well, our mission is to address the gaps in care that LGBT community members face in healthcare. And it came about in 2017, excuse me, when Dr. Grace Huizinga started looking at the gaps in care the LGBT community faced. Specifically, she was focused on HIV prevention and was finding that a lot of the providers in the Grand Rapids area weren't comfortable and weren't prescribing PrEP, a pre-exposure prophylactics medication that prevents people from contracting AIDS. Mm-hmm. And so she started trying to find out why and how to make that more accessible to the community, and that's just kind of expanded since then into this full-blown consortium that we currently are.
Where is the disparity? Is it with the healthcare system overall, or is it with providers knowing how to treat or what is needed in the community?
It's more about their education and their knowledge, because if you talk to providers and healthcare systems, they all want to provide high quality, appropriate health care for everybody in their community. But when you look at education, most providers that, if they've been out of med school more than a couple of years, they probably didn't get any education around LGBT health care. If they did, it may have been a case that they reviewed of somebody that maybe had HIV. Mm-hmm. So the education has changed, is in the process of changing over the last 5 years, at least locally. But I think for the most part, it's lack of education and training and understanding what some of the disparities are.
Okay, and what is the Healthcare Consortium doing to combat that?
We're partnering with anybody and everybody. So we work very closely with MSU College of Human Medicine. We've had an amazing collaboration with them for the last 2 years now. And we look at ourselves as like a convener and a conveyor. Mm-hmm. So we bring people together to talk about stuff that the community is talking that they need, and we're sharing that information with healthcare providers and systems, and vice versa. So we have a monthly meeting where we bring all of these folks together and share information. And we also do a yearly health experience survey. So we're asking community members, what experience have you had with the healthcare providers and what do you want them to know? And then once we gather all that, we share it with the systems. And we're hoping that that's making an impact, because they're not only hearing the stats and the statistics and the data and all that, there's often also patient stories attached to that.
All people who need medical care should, as we talked about, be able to see their doctors without worrying about being mistreated or harassed. The Affordable Care Act did help address some of these issues, but you still find that there is pushback in certain areas.
Oh, absolutely, and especially in the last year. There is so much anti-LGBT conversations going on across the country that if someone's mental health is not impacted by that right now, they're kind of living in a bubble. Because the last time I checked, which was a couple of days ago, there's over 500 laws being debated across the country that are focused on LGBT community members. And some of it is about health care for them. And it makes people feel targeted. There's a lot of fear. Mm-hmm. But also there's things happening, like in California, a woman was just killed because she was flying pride flag. She was an ally. She wasn't a member of the community. Mm-hmm. And so that does create a lot of fear and a lot of distrust and a lot of anxiety. And that does put people at risk, because by the time they do engage in healthcare, then it's often farther along in the disease process, so it becomes more expensive, more timely to be able to treat that, and it's not always the best outcome for both the patient and the community.
And the Healthcare Consortium is trying to work through that. What is your ultimate goal, Jenny, as you look to the future for the Healthcare Consortium and what you might want to accomplish in the community?
Well, if we were looking at Nirvana and Grand Rapids was it would be that everybody, regardless of how they identify, regardless of how they look, regardless of where they come from, they feel like they belong here and they feel like they're valued here. Because I think we're missing that a lot. Not everybody feels like they belong here, and not everybody feels like the community values them.
And you told me in a conversation we had earlier, respect is your default.
Absolutely.
And that's what you want to get people to,
Yes.
respect.
We need to get back to that, because when people say respect is earned, that's not true. If you have to earn it, then you're starting from a place of disrespect. But if you come to conversations as default of respect, I respect your values and beliefs. That doesn't mean that you and I can't have a conversation, even about something we disagree about, that I may learn something about.
That's very true, very true. That respect starting base right there.
Right.
Jenny Knight, Executive Director of the Grand Rapids LGBTQ+ Healthcare Consortium. Thank you so much for joining us today.
Thank you. It's been a pleasure.
We appreciate your time.